A brow lift is a surgical procedure designed to lift the eyebrows back up into their normal, youthful appearance and really allow the eyebrows to frame the eyes and thus frame the face, the focal point of the face. It's an ideal procedure designed to lift the brows up and try to re-anchor them before any treatment's ever done to the eyes, or sometimes no treatment needs to be done to the eyes at that stage, to really allow the upper third of the face to look rejuvenated and youthful. It opens up the eyes, creating less shadows, a less tired look, and it's a procedure that's exceedingly well tolerated by patients. The unique aspect is that a lot of patients that come in to get or to obtain rejuvenation around the face are looking for a correction around their eyes. They don't even realize it's their eyebrows that are actually the problem, and they really need a brow lift. A brow lift procedure is a surgical procedure performed under general anesthetic to address the shape and position of the brows. I usually perform a combination of both an endoscopic and an open approach to the procedure. So I'm making incisions in the patient's hairline, often to place an endoscope or a small telescope into and below the tissues just on top of the skull to release a lot of the soft tissues off the entire forehead and eyebrow region. Using the endoscope, I can carefully protect the muscles and nerves of the area, but I tend to weaken some of the muscles right between the eyebrows themselves, which tends to avoid or weaken that strong frown that we get between the eyes. Then what I do is I reposition all of the skin up with the brows in a normal and much more youthful position, and it's anchored in place with absorbable anchors that last and absorb over the course of about a year. Then the redundant skin that's needed to reshape and smooth the forehead is removed and resected, and the wounds are closed. Now typically this type of correction will show improvement in the shape of the brows for almost 8 years. Occasionally we'll get some lowering or minor ptosis that happens along the way. And of course this is age dependent with each patient because the results are variable depending on the age of the patient when you're starting to do the procedure. But it's a wonderful way of establishing a good shape and position of the brow. A brow lift is typically done when a patient starts to notice some falling of their brows, that lateral hooding or collapse of the outside of the brow that tends to make the eyes look darker, more shadowed, and sometimes patients feel that other individuals or people interpret them as looking angry. That's sort of when one would want to pursue this procedure, and often those changes happen in the early 50s, but certainly the procedure is very invaluable to people that are over 60, where they've got more pronounced changes of that nature. And for that reason, once we get into the 60-year-old category, we're often thinking about doing that procedure, the brow lift procedure, in combination with something like a blepharoplasty. So we're not only setting the foundation by putting the brows back in their normal positions and really setting that frame or shape around the eyes, but then also tailoring the eyelids to create that wonderful facial harmony in the upper third of the face. And that's the best way, if done in combination, to create long-lasting results in rejuvenation around the eyes. The common recovery from a brow lift procedure is approximately 3 to 4 weeks to allow some of the bruising to dissipate, with reduced activities such as cardiovascular activities or aerobic activities for about 2 weeks to try to reduce extra bleeding that might happen. Now, often that time is associated with periods of icing to control swelling around the eyes and the forehead area, but typically following those instructions, the recovery is fairly clear and straightforward. One of the questions I often get asked is, are there new advents and changes to the brow lift procedure over the last number of years? And really the biggest change is the combination of the traditional open approach, where just large sections of skin were removed from the scalp to try to lift the brows up, to the endoscopic procedure, which all the scars were essentially hidden in the hair-bearing scalp, and all the procedure was done without removal of skin. So the real advent is the combination of the two procedures, which is what I perform today, using the endoscopic procedure to do all the internal releases, maintaining the safety, trying to minimize the scarring, but also doing a temporal lift, which is a partial open lift laterally to really maintain that lifted position of the eyebrows.